My name is Leilani Lacson, and you're joining us today on Equal Hope on CAN TV. For those who are not familiar with Equal Hope, we are a nonprofit organization in Chicago whose mission is to help eliminate health disparities in Chicago. I'm Leilani, I'm the Data and Communications Coordinator there. So today we have Dr. Janelle Goodwill on the show. She will be talking about mental health issues and the Black community. Thank you, Dr. Janelle Goodwill, for joining us today.
Thank you, Leilani, for the invitation. I really appreciate you inviting me to join and to share with you today.
Great. And you've been on our show before, on our WVON show a few months ago, and you also talked about mental health in the Black community.
Yes, I had a really great experience, and I appreciate that you all figured that you could invite me back for a second time. So thanks so much.
Yeah, no problem. So today's topic is a very important topic and something that should be addressed. So before we get into some interview questions, let me give the studio audience some background information about mental health. So physical health is the state of our bodies. Mental health is the state of our mind, feelings, and emotions. Like how our physical health often fluctuates, so does our mental health. However, someone suffering from mental illness, such as depression and anxiety, may be unable to function over a long period, similar to a physical condition. Among Black Americans, 16% have reported having a mental illness in the past year. The mental health experience of Black Americans is unique as it has been characterized by a history of trauma and violence, impacting the emotional and mental health of both youth and adults. Help-seeking behavior is affected by mistrust of the medical system. Unfortunately, Black and African American providers, who are known to give more appropriate and effective care to Black and African Americans suffering from mental illness, make up a very small proportion of the behavioral health provider workforce. Because of these factors and more, Black and African American people are more likely to experience chronic and persistent mental health conditions. However, as light sheds on these issues, health systems are working to evolve better systems to eliminate inequities in mental health services. So Dr. Goodwill, tell us a little bit about yourself and how you got involved in the mental health field.
Great. So thanks for that opening question. So just to share with the viewers and listeners, I am currently an assistant professor in the Crown Family School of Social Work Policy and Practice at the University of Chicago. I consider myself to be a fairly new Chicago resident. I moved here during the pandemic in the fall of 2020, and so I'm definitely still getting acclimated and connected in the city. I am a mental health researcher, and really my entire body of work and really what I've dedicated my life to is using research to really try to address some of the really serious concerns and gaps that we're seeing in services that are provided to Black Americans who may be experiencing suicidal thoughts, along with other mental health concerns, as you mentioned, Leilani, related to things like anxiety and depression. And so, although I'm an assistant professor now, I'm a researcher here at U Chicago. Before that, I really had a much earlier journey and introduction to research. But really beginning my first semester of my year in college, I did my undergraduate studies at Michigan State, and I began volunteering in research labs with professors at that time. And since then, I've just had opportunities to get more and more connected with topics that are directly related to mental health. So I would say by the time I transitioned to the University of Michigan, where I earned my master's in social work, that was a time where I began to actually work in an intern in settings where we were providing mental health services to folks who were in need. But then when I went to the next phase, which is completing my PhD in social work and psychology, that's where I really did a lot of work doing intervention work, but also analyzing really large data sets that address topics related to things like suicide, coping strategies, social support, hopelessness, all of these factors that can contribute to mental health experiences among Black Americans and other populations. And so really I've seen this thread just kind of progress throughout my time in education. And I'm really grateful to be in Chicago now because I think that there's a great opportunity to provide better services to Chicago residents during this time.
That's really great. So you did mention research. So you are the lead researcher on an intervention and helping reduce the number of suicides among Black youth. Can you tell us a little bit more about your research?
Certainly. So this is a very, very new project. It's funded by the National Institute of Mental Health. So this is one of the institutes from the larger National Institutes of Health. And so this project is focused on the experiences of Black middle school students and really trying to ensure that we can provide some school-based resources. I really think that there's an opportunity for us to meet people where they are. We know that there are disparities in terms of who has access to mental health services, and they can be particularly challenging if someone does not have insurance or if they don't live in a community or neighborhood where there are local providers who are making their services available. So for those reasons, there was a need to implement some school-based services in Chicago, particularly on the South Side. And so this project is really focused on taking an existing intervention that's already been implemented among over 50,000 middle school students and high school students all across the country. And instead, what my team is proposing is to take that existing intervention and to adapt it in ways that would be relevant for Black students here in Chicago. And so we're in the very early stages of this project. It's actually a 3-year project. So we just started in April. And so really the goals of the project over the coming years would be to collect qualitative and survey data, and then to also begin to pilot test the intervention to see if this is something that we could actually implement across even more schools, not just on the South Side, but maybe even in other neighborhoods as well moving forward.
Well, that sounds like really great research. What do you think is successful in helping prevent suicide among Black youth?
Well, that's what we're trying to investigate. Really, this funding opportunity came from NIH because there's been really a limitation, I think, in the amount of research that focuses on this population. Mm-hmm. There certainly have been scholars whose work is really focused explicitly on the mental health needs of Black youth and Black students, but there's still so much that researchers don't know. And so we are really trying to answer that question through this intervention because in a nutshell, Leilani, we simply don't know enough about what we can best do to serve and support Black students, particularly young Black students here in Chicago who may be experiencing some serious mental health and psychological concerns. What we can say generally, though, is that people who have access to mental health services are certainly in a better position to actually utilize those services. And so when we look across national data sets, we see that Black students are utilizing mental health services at lower rates than youth of other race groups. And I think that certainly points to not an individual issue, but really a structural and systemic issue in the sense that there are likely many Black students who simply do not have the same access that youth in other race groups do. And so by providing a school-based resource, we're really trying to get around the fact that whether or not you have insurance, whether or not your parents are in a position where they can physically take you to a mental health provider, we certainly want to still provide some mental health support and education while students are in school and beginning at an early age.
Great. What is the current state of the mental health of Black people living in Chicago?
Well, I think that is a really difficult and complicated question. I think that, I have not begun to do actual survey data here in Chicago. I'm still in the process of doing that with this intervention, but also through other work that I have planned moving forward. But Leilani, when I look at publicly available data, so things like data from the Medical Examiner's Archive, we can see really important trends there that I think are alarming and that people may not be aware of. So if people were to go back, if any of the viewers or listeners were to go back and look at some of the news articles that were shared publicly in the summer of 2020, so articles published by Trace in the Chicago Sun-Times were pointing directly to an increase in suicides among Black Chicago residents, Black Cook County residents in 2020. At the end of the year, we saw that the number of suicides among Black Cook County residents increased from 2019 to 2020, while the number of suicides for residents in other race groups decreased. By the year of 2021, we began to see those numbers increase in other groups as well. But it does raise the question, what exactly was happening in 2020 that led to this increase in suicides among Black residents, whereas we saw a decrease in residents from other race groups. Now, again, these are not my data. These are publicly available data that anyone can go see at the medical examiner's archive because they count the number of suicides there. And so if we're looking at suicide as a primary outcome, then we can see that there are some serious concerns, some serious issues that people are facing. I mean, for someone to get to the point where they feel that ending their life is the best option, really, I think points to an immediate and urgent need for us to ensure us as neighbors, as a community, as residents of Chicago and of Cook County, to ensure that we're doing all that we can to provide services to those who are in greatest need. And so I think the data from the Cook County Medical Examiner's Archive points to some serious signs of distress and deep concern that have not begun to be fully addressed by researchers yet.
So you mentioned 2020. Can you tell us how the pandemic has affected people, what role it has played with the number of suicides and number of cases of mental health issues?
Yeah, so that's another great question that I think many of us are still very much trying to wrap our head around, because unfortunately we're still in the pandemic. It's still going on. We're still seeing the impact of all the things stemming from COVID-19 and other issues that are emerging during this time. And so we do see that stressors related to things like material hardship, stressors related to the unexpected grief of losing a loved one, the unexpected issues that can arise when you're experiencing financial hardship. All those things have had direct impacts on families, and particularly Black residents Black citizens really across the entire country during this time. But we also know that when we think about who is primarily working in these jobs where they maybe don't have as much flexibility to work from home or to stay home during some of the quarantine times, we have to consider that that's a racialized encounter, and there's disparities in that as well. And so during the pandemic, we've certainly seen an increase in anxiety and depressive symptoms. The data are mixed in terms of the number of suicides. So like I mentioned, I pointed to the data from the Cook County Medical Examiner's Archive, but you have to disaggregate the data in order to see those race trends. So while the number of suicides in Cook County had increased for Black residents in 2020, we saw a decrease during that same year in other groups. And so I think it definitely does point to some differences. But now that we are in 2022 and this pandemic has raged on, we've all been impacted in different ways. But much more research is needed before we can confirm how the COVID-19 has impacted one race's mental health versus another.
I was gonna ask how the pandemic has affected students. Like, in your experience, what have you seen personally?
Well, I think that this is really challenging because there's been, just fierce debate around safety, around vaccines, around school closures. And I think it is so important that we hear not only the administrator's point of view, but also from teachers and from young people themselves and from parents and families. And so during this pandemic, we've certainly seen serious concerns raised around isolation, around loneliness, around lack of physical activity, and certainly around students falling behind in their work. However, that's really hard to balance when we're facing a global pandemic where people are dying, disproportionately people of color and Black people at different points throughout the pandemic. And so I have seen reports that across the country, different school districts have utilized different approaches to try to address student mental health. So for instance, there was an article in the New York Times that came out last year where the Las Vegas school district actually was using some internet searching monitoring devices because they began to notice that students in their school district were searching for information on how to make an attempt for suicide using the tablets and the devices made available to the school district. And so we've seen different responses be implemented across the country, but we can certainly say that there's been a serious psychological impact on students during this time.
Yeah, the pandemic has definitely affected everybody in one way or another. So, besides the current pandemic, what other factors have been affecting the mental health of Black Americans today?
Mhm. Thank you for raising that question. I think it's important whenever I talk about these topics, it's important for me to point to the fact that right now the topic of suicide is getting much more attention in the media and in the news than I think ever before. Particularly when we're looking at the experiences of Black Americans, we are seeing that there's been more conversation. I would say not enough, but certainly more than previous years. However, Leilani, this is not a new occurrence. We can look at data from the CDC and other governmental agencies that tell us that even as early as the late 1980s and early 1990s, we saw that suicide at that time was the third leading cause of death among Black males ages 15 to 24. And so this has been a serious issue for a long time. There are a number of scholars, particularly Black researchers and scientists, who've been pointing to this issue for decades, but it is now that I think people begin to pay a lot more attention. So in responding to your direct question around what factors contribute to negative or poor mental health outcomes, certainly we see that racism is a serious concern, whether it's the type of daily sort of stressors or race-related events that someone would experience, maybe interpersonally, maybe in a store or at a restaurant or on their job, but also these major sort of events where we are consistently seeing Black people killed on the news, on social media, that has serious impacts on our well-being. Other stressors related to financial concerns. We see this a lot among adults, that if someone practically cannot meet their financial needs, then of course they would be experiencing some serious mental health concerns. And as a researcher, it's really hard to try to address someone's basic mental health needs when their practical daily needs have not been met. Other stressors related to things like self-blame and hopelessness, we've seen be really persistent in terms of predicting worse mental health outcomes. And also there's been some concerns that are raised among people who live with maybe some sort of serious illness or chronic pain. That could certainly be another stressor that folks are wrestling with. So there's several factors to consider, but I think that those are some that we must address. And then also there have been a number of studies that have focused on things like gun violence and the presence of gun violence in communities and how that certainly is impacting people's well-being and psychological health over time.
So going back to one of your points, you mentioned that suicide among Black Americans and mental health issues wasn't an issue, but it has been an issue, but not highly publicized. Why do you think that's the case, and why is it gaining so much attention now?
I think that perhaps there's just been this sort of maybe misunderstanding or approach that maybe suicide is not something that Black people actually go through with or that Black people actually do, but the data suggests otherwise. I will say, Leilani, over the past several years, we've seen that typically when we are comparing rates of suicide among Black Americans versus other groups, we have seen that typically Black Americans are reporting lower suicide rates when compared to other race groups. I think what's led to the greater increase in attention and discussion on this now is, number one, we're seeing a lot more conversation about suicide nationally in terms of media, in terms of popular culture. This year alone, we've seen, I think, a lot more conversation around suicide among Black Americans, and particularly among celebrities, people with high profiles and large platforms. And I think also, number two, Leilani, there was an important study that was published, I want to say maybe about 5 years ago, by researchers at Nationwide Children's Hospital at Ohio State University, where they essentially found that the number of suicides among young Black children, so those younger than 13, the suicide rates for young Black children were up to 2 times greater when compared to white children. And so that was one of the first times where data were showing that the rates of suicide among Black children in particular were greater than children of other race groups. And so I think that was really one of the catalysts that pointed to some serious concerns, along with a 2019 paper that was published by Michael Lindsay and other colleagues at New York University, who found that using data from CDC Youth Risk Behavior Survey, that the rates of attempts among Black high school students had significantly increased over time as well.
What would you say are the unique mental health experiences that Black people face versus their white counterparts?
Yeah, I appreciate that question, Leilani. I think it's one that I hear often, and so I want to answer in two parts. So first, I want to say that I think it's important that we make clear that we essentially don't always need to compare in order to recognize that this is, something that's really important. I do think that a lot of times when these data are presented or discussed, it's oftentimes presented in a comparative way where we want to see how the number of suicides or the number of mental health experiences among Black Americans is related to or comparable with someone from other race groups. But a lot of my work is focused on within group differences. So I really, a lot of times I'm looking at the factors that are happening within a group and not always comparing to other groups. And so I think it's important to first note that it is okay to focus on one particular group and to assess really some changes or some differences within those groups. I think number two, some of the really specific factors I think that, and unique factors that might be particularly relevant among Black Americans relative to white Americans or other race groups is certainly the history and legacy of slavery in the US, the long-term implications and the implications that are still felt very much today, where I think that generationally and culturally, there are messages that are shared that we really should not seek help, or that it's not okay to seek help, or that we oftentimes may not know where to seek help. And so I think in those cases, that could be very different than maybe someone who grew up their entire life hearing that going to a therapist was normal, or learning that it is okay to seek mental health help from a very early age. Now, I want to be clear, that's not specific to Black Americans. I know that there are certainly many other cultures, and we see this a lot in research, particularly among Asian students that we've seen, and even among Asian college students, that there are some really strong concerns around cultural stigma for seeking help for a mental health concern. And so I do think that not just racism, but also the stigma that presents itself in terms of seeking help is certainly something that's unique to underrepresented groups and Black Americans in particular.
So how do we destigmatize getting help for mental health issues and things that if you just don't feel right in your head?
Well, I think that one helpful strategy really could be utilizing and implementing school-based interventions at an early age. I think if there's a young person who in 5th grade or 6th grade is learning about mental health concerns, is learning about what it means to seek help for any sort of mental health condition you may be experiencing, that could certainly change a generation. I think that if structurally there are consistent sort of supports and psychoeducation that's made available in schools, and if that information is repeated, not just in middle school, but also in high school and in college, then to me that certainly, I think, has some implications for ways that we could destigmatize seeking help for mental health concerns early on. Essentially, Leilani, I think that it's pointing to, and I think raising the question about building a culture of prevention, because sometimes I think that it can be very easy to respond to a mental health issue once it already arises. But I'm encouraging us to think about what it means to be proactive in providing people with the information and tools to address a mental health concern before it even arises or comes up. And so I do think that one way to destigmatize seeking help for mental health issues could be to utilize school-based interventions as ways to reach students and parents from an early age.
You know, as you were talking about that, I started recalling my experience when I was in grade school and when I was in high school. And I don't remember ever learning anything about mental health. It just was never talked about when I was in school.
Yeah, I have a similar story. I mean, I didn't grow up in Illinois, I grew up in Michigan, and I would say the same. I think that particularly when we think about the sort of curriculum that's taught at the middle school and high school level, all across the country, we see that there are health education classes. And I think that there's really an opportunity, and many researchers have already done this. I'm certainly not the first by any means. There are a number of researchers who are really thinking about how existing classes could be adapted to really introduce and to implement mental health curriculum into the training that students receive in middle and high school.
So we have a few minutes left, Dr. Goodwill, and I'm going to ask you some important wrap-up questions for our audience. So what should someone do if they know that someone they're really close to is possibly suicidal?
That is a really key question, and I'm so glad you asked this. I think it's so important that we not only provide help to those who are experiencing a crisis, but that we're also equipped to help refer someone to the appropriate sources when we do know someone, or when we really care for someone or love someone who's experiencing a mental health challenge. So I want to encourage anyone who's watching to go to the internet and to type in afsp.org. That's the American Foundation for Suicide Prevention. Again, the website is afsp.org. When you go to the afsp.org homepage, you see that across the top, there are a number of options you could select. If you select the second option, it says get help. And there you can receive some step-by-step directions that provide information for people who themselves may be experiencing some thoughts of suicide, along with instructions for people who are concerned about a loved one or a friend who is experiencing suicidal thoughts. I also want to say that it is important to really disrupt a myth. Because I do think that a lot of times when we're having conversations like this, sometimes people are under the belief that asking someone about suicide will introduce the idea in their head or make them suicidal. And I just want to say that research does not support that idea. Asking someone about suicide, if you're concerned about their well-being, does not give them the idea or make them suicidal. Instead, asking directly, if there's someone in your life who you're concerned about, providing them with the opportunity to really share openly with you and asking them directly if they've considered suicide and if they've made a plan are key questions that you can use to then help refer them to emergency resources or to a local mental health provider. But again, I want to encourage you to check out afsp.org. That provides really helpful step-by-step instructions for what you can say to someone who you love, someone in your own life who's struggling with their mental health right now.
So afsp.org, everyone, if you know anyone who has been having suicidal thoughts or you think they're on the brink of suicide. So really quickly, how can someone seek help or how can someone find a therapist?
Great. Yeah, that is, I think, a challenge that unfortunately can oftentimes be much harder than it should be. I think there's a really helpful list of resources that I found on the internet that's local here to Chicago. It's published on the tribe.com website. So that's tribe with 2 I's, the tribe.com website. This is an article, Leilani, that was published in October of 2021. The article was written by Matt Harvey. I don't know Matt Harvey, but I really appreciate Matt for publishing this article. I refer to people all the time. And the article is titled 7 Opportunities for Free and Low-Cost Mental Health Counseling in the Chicagoland Area. I'll send you the link so that you can actually maybe post it in the show notes or share this with others who might be emailing or contacting you with questions. But essentially, this article provides some really helpful suggestions for local mental health providers here in Chicago who are able to provide services to people. So I'll highlight a few. I won't go over all the details, but there are some particular ones that are highlighted here that I think are certainly important to provide to listeners. So there is Sista Atha, and that website is sistaafya.com. And so I think it's important for folks to understand that this mental health provider is Black woman owned and really focuses on the experiences and mental health experiences of Black women. And they are on 71st Street. There's Grounded Wellness, and their website is groundedwellnessllc.com. They're located on East 53rd in the Hyde Park Bank Building. There's also, which people may see when they're driving around town, but there's the Access Community Healthcare Network. Mm-hmm. Their website is achn.net. And so there's a number of locations. There's one on 47th, that's the Booker site. There's also the Gary Comer site that's further south. And so again, that website is achn.net. And those are all local facilities that are a part of the Access Community Healthcare Network. Also want to highlight there's C4 Chicago. Their website is just the letter C, the number 4, chicago.org. and also the YMCA Chicago Wellness Network. And so I'll again send you this link. I think it provides some really helpful insights and suggestions for people who are looking and who want options really to consider when they're looking for someone to see here in Chicago.
Okay, sounds great. Yes, please send me that link. Thank you, Dr. Goodwill, for being on the show. Everyone tune in on August 23rd for our next show. Thanks, everyone.